Good morning, good night, good afternoon, doctors and nurses. I'm DrChe, and today we will discuss some reading tips. Just let me open. Can you see my screen?
Yes, sir.
Yes, sir.
Okay, thank you. So we have done almost 14 questions. Rest of the questions we will do today, and then we will move to part 14 questions. Rest of the questions. Okay, so some of you have joined me on Facebook also. Okay, so just a quick recap of the text, then we will continue, okay? So anybody can just remind us again how to do part A, what is the strategy? Yes, please. This is very easy. Just first we need to skim and scan. Just skim and scan the headings, main headings, the key points, and see what is included in each text and in each paragraph. And then read the question, try to find the answers quickly, okay? Because the time management is the most important thing in reading part A. So as most of you already know about this, and some of you might have joined today, okay? So just a quick recap of the three texts. So this is the first text in which, so there is what is pertussis, okay? So this is the just introduction. Is contagious, the name of bacteria, how it is spread, then okay, transmission of this, and then historically some things, some information about pertussis. Then we have these graphs, okay, changes in pertussis incidence in relation with the introduction of acellular pertussis vaccine in the US, UK, Australia, and Ireland. So these graphs are talking about that. And then here a little bit about pertussis vaccine. In each case, pertussis vaccine was spread through abrupt increase in this and that. Okay, so in 80s what happened, in 90s what happened. So this is quick skimming and scanning. We don't need to read the whole these two sentences or this paragraph, just the main thing. Okay, and then we have this graph, okay, in which we have multi-centric hospital-based surveillance of pertussis among infants admitted in tertiary care facilities in India. Okay, so then we have prevention here. This is the prevention. We don't need to read mostly. It would be the best way to prevent is immunization. WHO recommends this, and vaccination of pregnant women is effective. So this is enough for this part. Okay, and then we have part D, in which there is timing of treatment. In early, please mute, please. In early stages, what we need to do. So then what a person can do if there is an infant, when to start the treatment. Clinicians so strongly consider treating prior to test results if clinical history is strongly suggestive. Persons with pertussis are infectious, then post-exposure microbial prophylaxis. Even we don't need to read this part because you already know what does this mean. Okay, so now we have done 14 questions of this sample. This is my own sample. This is not a copyright of anybody else. So let us read the part, question number 15. The antibiotic will be ineffective if the pertussis is diagnosed late by a dash. So in which text is possible to find the answer? Any nurse can just discuss. Just write in the chat, where it is possible, in which text. Any nurse? Any nurse, please? Can unmute and talk with me, any nurse? No? Okay. Question number is 15. Let us try to find the answer in text D. So most of you are saying text D. So here is the question. Please try to find the answer and let me know. Just write in the chat what is the answer, okay? Just write in the chat what is the answer, please. Now it is fill in the blank, okay? This is not just in which text. So now it is fill in the blank and try to fill in the blank, okay? The question number is 15. Please write in the chat. You can write on Facebook. I can see chat of Facebook also, and you can also write in the chat of Zoom who are already with me online on Zoom, and I'm also watching your reading your comments on Facebook. So the question is written at the top and text is D. Try to find the answer, please, and write in the chat. Your answer should be written in the chat. Any nurse can talk with me, please? Any nurse? No? Okay, any doctor?
I think in the second paragraph, the first sentence, they mention
Yes.
test result if clinical history.
Yeah.
Yeah, here is strongly suggestive. I think by diagnose better by, I think a clinical history.
Yeah. Your answer is right, but you don't know where is the answer.
Yeah, in the second paragraph,
where is the answer?
Lord second line.
Hello, sir.
Diagnosis the
Yes,
patient
please.
late. Antibiotic will not alter the course of the illness.
Sir, second paragraph.
Yeah,
Second paragraph. Doctor,
paragraph.
which line? Which sentence?
Sir, if a clinician diagnose the patient late.
Yeah.
Second line.
Yeah, okay.
Yes.
So you
Yes,
can
sir.
see this is called paraphrasing. You can see these two sentences are the same thing, but why I have written in different way? Because if I write in directly, okay, if a clinician, then fill in the blank, then diagnoses the patient late, antibiotic will not alter the course of illness, okay? Instead of will not alter the course of illness, what I am writing?
I think just a clinician. I think by a clinician,
Yeah, the answer is clinician. But
yes.
let us try. Our focus is not to just answer accurately, but our focus is to see how the examiner, how the samples are made, okay, how we make the questions and what we need to do, how to quickly answer, okay, and how to find the answer. So the thing is, antibiotics will not alter the course of illness. So which synonym I'm using for this part?
The antibiotic will be ineffective.
So ineffective, okay, will not
Yes.
alter the course of illness, which means it will be ineffective. Just only one word, this ineffective is the synonym, is the, paraphrasing
Antibiotic.
of all of this part, okay?
Antibiotic will not sufficient for the
Yeah.
illness.
Yeah, okay. So antibiotics will be ineffective if the patient is diagnosed late by a clinician, okay? If you see that this clinician should strongly consider treating prior to test results if the clinical history is strongly suggestive or a patient is at risk of severe or complicated disease. Here clinician is mentioned, but our answer is not in this sentence. Okay. Sometimes there are some changes in the next sentence, and we should tell our keywords. Okay, our keywords match here in this sentence, and our answer is clinician. Okay, this is very important thing you should keep in mind when you are doing samples, because many people keep doing a lot of samples at the end they don't improve. The reason is they don't know how to answer the questions and what are the things that they need to see and what things they need to learn. Okay. Now the question is, in which country the AP vaccine was introduced most recently? In which text you can find the answer? Text B, okay. Please mute. If you want to talk with me, you can unmute when you need to talk. Otherwise, please mute. Okay. Other people will get annoyed. Okay. For me, there is no issue, but for other people. So this is your question. This is your question at the top, and these are four graphs. So please try to find the answer and write in the chat. Okay. Guys who are on Facebook with us, they can write in Facebook. And those who are on Zoom, they can write on the chat of Zoom. Okay. So what is the answer, please? Very good. Australia. We have one answer on Facebook is Australia. And on Zoom is England. Let us see what happens. Other people. Please mute. If you are not talking with me, you should mute. Okay. So most of you are correct because we have already discussed these graphs. Okay, you can see still some people are saying Australia. Yes, Australia. So we have two answers. One is Australia and one is England. Okay. So those whose answer is Australia, please, anybody can explain me why?
Sir,
Those who, yes, please.
sir, if we see the Australia, that is 1999, sir. Okay, sir. In
So,
England and Wales, it is 2005. It means recently, sir. Recently, that's 2005, sir.
no, I'm asking those who have answered Australia, why their answer is Australia.
Sir, it's England.
Some of you have given the answer Australia, and my question is why the answer is Australia. USA. Why?
USA is the question because they provide their EP introduced in 1996.
Okay.
on the above paragraph.
Okay, so those your answer is this, and those whose answer is Australia, could you please tell me why your answer is Australia? Okay, so we have
England,
four. Yes, please.
England and Wales.
Okay, so we have four here countries: USA, Australia, UK, and Ireland. So we have four countries. So the answer, question is, was introduced. AP vaccine
England
was introduced. AP vaccine was introduced. Here it was introduced in 1996. Here 1999. Here 1996. And here
2005.
2005. Okay. So most recently means that is close to now over time. Okay. For example, we are in 2022. Most recent is 2005, not 1999. Okay. It means the last one, not the earliest one, not the first one. These simple words will change your answers in the real exam, and you will remember me in your exam. Okay. So the answer is England and Wales. Okay. Now the next question. Introduction of pertussis vaccine resulted in decreased incidence, but in areas with less vaccination, dash has started. In which text you can find the answer? In which text you can find the answer? In which text you can find the answer? In C, in prevention, no. Sorry. In B, okay? In B, the graphs. Here you have your four graphs, and here is the text also. And here is your question, okay? Please try to answer and write your answer in the chat, okay? Write your answer in the chat. So we have first answer, adverse effects. Cannot distinguish, the year is not clear. I don't know what you want to say. Second answer, adverse effects. So guys on Facebook, please answer. Adverse effects, Dr. Yubi, Ms. Shiva, Dr. Momal. Adverse effects. Krishna, adverse effects. Events. Okay. Yes, please. Please mute. Please mute. We have a very difficult question. Mute, please. Actually, your answer does not fit grammatically here. Adverse effects. No. Introduction of pertussis vaccines resulted in decreased incidence. Okay. But in areas with less vaccination, dash have started. Okay. In each case, introduction of pertussis vaccine preceded an abrupt increase in disease incidence rates following a delay of about a year. The declining incidence seen. The declining
And
incidence.
please scroll a little to
Please mute.
see all question.
The declining incidence seen from the UK and from the early 90s is likely explained by a reduction in whole cell pertussis vaccine uptake that occurred in 90s following severely highly publicized adverse events that were authorized. That were attributed to versus. Okay. Introduction of pertussis vaccine resulted in decreased incidence, but in areas with less vaccination, dash have started. Okay. Declining incidence seen from the UK. Reduction in all severe several high. There's some confusion here. The introduction of pertussis vaccine resulted in decreased incidence. That is okay. Overall, decreased incidence. But in areas with less vaccination, which areas with less vaccination? Declining incidence seen for the UK. Declining increase in, okay. But the declining incidence seen for the UK from the early 90s is likely explained by reduction in whole cell uptake. Introduction of pertussis vaccine resulted in decreased incidence, but in areas with less vaccination, this is a little bit technical problem, but your answer, adverse effect, does not fit grammatically here. Okay, adverse events is totally wrong. Okay, so the answer, let me unmute if anyone wants to participate. Okay, adverse effects does not fit here grammatically. The introduction of pertussis vaccine resulted in decreased incidence. Okay, it resulted in decreased incidence. That is okay. After that, there was an increase. But in areas with less vaccination, which areas UK and Republic of Ireland, where there was less vaccination, declining incidence have started, was seen. Okay, even you can use past tense, was seen. Okay, if I use the same word seen, then you will be able to find, but that is why I wanted to say had started or was noticed. You can use like this. Okay, so the answer should be declining incidence. I can change a little bit the question, but overall, adverse events was wrong. Okay, totally wrong. Here, better is declining incidence. Okay, I need to rearrange this question a little bit. So the answer should be declining incidence. Okay, introduction of pertussis vaccine resulted in decreased incidence. Overall, there was a decrease in incidence, but after 5 to 10 years, there was an increase. But in areas with less vaccination, these are UK and Ireland, declining incidence was seen, was noticed, something like that. Okay, so adverse events does not fit, but in areas with less vaccination, adverse events have started, does not fit here. Okay, it is wrong. Anyway, question needs to be a little bit fixed, but overall this was not the answer. Adverse effects. The next question, in tertiary care facilities of India, in which month or months the clinically suspected cases of pertussis were 20. So in which part we are going to find the answer? B. Yes, in B, in this part. So please try to find the answer and write in the chat what is your answer. So what is the answer here? What is the answer, guys, on Facebook? Very good. So your answer is correct. So here the question is, in which month clinically suspected? So this part is clinically suspected. And this pertussis, it means this is lab diagnosed. Okay, this line. So here our question is 20, in which month there were 20 clinically suspected, okay? Clinically suspected. So there is the answer, December 18. That is good. Excellent. So in which week or year the first booster dose of pertussis is recommended? In which text you can find? You will not get all the questions difficult. Some questions would be difficult, some will be easy. So guys on Facebook, if you want to participate, please participate actively. Otherwise, we're going offline from Facebook. Because we have a lot of people on Zoom with me. So, okay. So in which text, let me see. Text C. So here is your text and here is your question. Try to answer this, please. What is the answer? Write in the chat. I think there is enough for Facebook. So if anybody that is on Facebook, if you want to join us with us directly on Zoom, you can text me on my WhatsApp, okay? Still there are 4 people. Okay, let's continue. Okay, so what is the answer? 6 weeks. Early as 6 weeks, okay? What is this? Second year of life. Some people are saying 6 weeks. Some people are saying second year of life. What is this? Why your answer is not the same? Six weeks or second year of life? What is this? Early 6 weeks. Very good. Excellent. Okay. 6 weeks. Very good. So 50% of you are saying 6 weeks and 50% are saying second year of life, maybe 40, 60. So please, anybody can tell me why the answer is 6 weeks? Simon, Miss Simon. Or Miss Nakala, Sifi, Kili, Nakala, please. Any of you? Simon Javed, Vijaya Lakshmi, Miss Lakshmi, Amira Ali. Any of you can talk with me, please. This is not good if you are not participating actively. Okay, anybody wants to participate?
So it will be second year of life because it's a booster
No,
dose.
I'm asking why 6 weeks. Those who have given the answer 6 weeks, why they have, most of you, some of you, 50% of you almost have given the answer 6 weeks. So just I want to ask why they have given the answer 6 weeks.
Sir, this is first dose, sir. This is
This is
first
first
booster dose.
dose. Okay.
Yeah.
So you can, what is the difference between first dose and first booster dose? What is your keyword?
Keywords.
Is first booster dose, not first
Yes.
dose. If I remove the word booster, so what is the answer?
6
It will
weeks.
be 6 weeks.
6 weeks. If I put the word booster, then what is the answer?
Second year of life.
Second year of life. So this is how you people get tricked, okay? You can see many of you have given the answer 6 weeks. Many of you. Not some, many of you. Almost 40% of you have given the answer 6 weeks, okay? So please read carefully. Answer is not always straightforward. Sometimes it looks very straightforward, but it is not straightforward, okay? The first booster dose, this is just first dose. So you have given first dose at 6 weeks. Next dose is subsequent doses. These are subsequent doses, not booster doses. 4 to 8 weeks apart at 10 to 14 weeks and 14 to 18 weeks. Done with doses. Now is the booster dose here. The booster dose is recommended preferably during the second year of life. As there is only one mentioned booster dose, so I can put as first, just to confuse you with the first dose, with the first booster dose. So please be careful. These are very small things, but overall, these things will make you fail or pass. Okay. What I have said, anybody can repeat? These are small things, but if you don't take care of these things, you can miss some questions, some answers, and you will, you are at the risk of failing, because these are very easy things. But when you are under exam anxiety, when you are under time pressure, then it becomes difficult to answer these questions. Okay. The last question. The rate of pertussis in each country after 5 to 10 years of introduction of acellular vaccine was noticed. Looks again difficult. Okay, the rate of pertussis in each country after 5 to 10 years of introduction of acellular vaccine dash was noticed. In the rate, okay, not in the rate. In the rate of pertussis in each country after 5 to 10 years of introduction of acellular dash was noticed. So in which text? Definitely the columns, okay, the B, the graphs. So here you have graphs and you have some text also, and here is your question. Okay, please try to find the answer and tell me what is the answer. Guys on Facebook, please try to participate actively if you want to learn something. If you want to learn something, please participate actively, otherwise there is no benefit. Please mute. Disease. So you can see, so many of you are giving different answers. Give the exact answer, please, if you know. Don't write half of the sentence, just write some words only, please. You don't need to write 1, 2, 3, 4, 5, 6 words, no. Decrease in disease, Miss Mavish, very good. So after 5 to 10 years of introduction of acellular vaccine, decrease in disease was noticed, okay. decrease in disease. Okay. Please try to fit the things that try to fit it grammatically also, not only what you are seeing. Grammatically, it should be fit also. Choose those words that should be grammatically fit here. Grammatically should be fit here. Adverse effect. Very good. So why you people are writing this disease incidence? It is not the rate. The rate, it already remained the rate, okay? The rate of pertussis means disease incidence, rates. Rate of pertussis means disease incident rate, okay? You just need to tell what is the change, okay? So answer should be adverse effect is wrong, Dr. Moman. In the rate of pertussis in each country, after 5 to 10 years of introduction of a solar vaccine, an abrupt increase was noticed. It's very easy. An abrupt increase in the incidence of an abrupt increase in the rate of pertussis was noticed in each country after 5 to 10 years. This is simple word sentence. So what I'm doing is I'm changing the order of sentence to make it a little bit difficult for students, okay? A simple thing. After 5 to 10 years of introduction of a solar vaccine, the rate of pertussis incidence was, there was an abrupt increase in rate of disease incident, okay, like this. So I'm just changing the order of sentence and many of you get tricked by this. So please be careful. The things are not straightforward and not, you know, too easy. Anybody raised a hand? Is there any question? Is there any question? No? Okay, now let us do one question for part B. And before going to that question, just let me tell you a little bit quickly.
All right.
So we have our VP hybrid course for writing, in which you will get a lot of corrections. In the course, there are 14 corrections with classes, but mostly if I'm free and mostly my students keep sending their letters. So VIP hybrid course. Why it is hybrid course? It means that if you are on duty of some day, you can send me letter and you will get feedback. Okay, that is why it is called VIP hybrid course. Okay, so here is the course. VIP hybrid course. You will get daily lectures plus 14 letters correction. Duration is 14 days, 3 referral letters, 3 urgent referrals, 3 discharge letters, 2 letters to non-medical professionals, 1 letter in which there is a pediatric patient, and in 1 letter there are 2 patients in 1 letter. 1 is GB to GB transfer. In case of nurses, it would be 1 community nurse to other community nurse transfer. Okay, if anybody wants to join, the timing is 5 p.m. UK time. No, this is paid one. This is paid one. Okay, fee is 100 British pound. After 30% discount, you will be paying 70 pounds. It takes a lot of, time and effort to help you to improve the writing because it's not easy and straightforward. Okay. So let's do one question now in reading part B, and then we will disappear. Okay. So here is your question. Sorry. So this is reading part A or part B or C. The strategy is the same almost. So please try to answer this. And strategy for part B and C is almost the same. Okay. So many of you keep saying, some classes for part C. So the strategy is almost same. You can use for part B or C. Okay. Let us disappear from Facebook because many people have left us on Facebook, but still.